Welcome, everybody. My name is Andrew Hone, and I'm the President and CEO of the Portland Business Alliance, Greater Portland's Chamber of Commerce. Thanks for joining us today for our COVID Recovery Roundtable. Everyone here at the Alliance hopes you are well, that you're staying safe and healthy, and while our community continues to navigate the process of what a phased reopening looks like for this part of the state, please continue to practice safe physical distancing and help all of us contain this pandemic. We say this at every event, but there are not enough thank yous available, of course, to our frontline healthcare workers for their continued efforts at this time. During this COVID-19 pandemic, we continue to work diligently in being a resource to our community. And we have set up this page, COVID-19 Focus, that is updated regularly with all the information that you as a business need to be able to adjust, adapt, and innovate. And follow us on social media for updates. And you can find us on Twitter and Instagram and elsewhere at these handles and hashtags. After this event, a recording of the presentation and links and resources mentioned will be available on our website shortly after we wrap up this morning. And of course, none of these events could happen without the support of our members. So thank you, members. We really appreciate it. And we have an incredible sponsor that I would like to thank today, U.S. Bank. U.S. Bank is the series sponsor of the COVID-19 Recovery Roundtable series. And they were founded right here in Oregon in 1891 with a long history of serving businesses of all sizes across the region. U.S. Bank is one of Oregon's most philanthropic companies and provides living wages to 5,000 employees in the Portland metro area and across the state. Stacy Dotson, Karen Kerwin, Dave Swartley, the entire team at U.S. Bank, we really appreciate everything that you do for us, the Alliance, and really being on the economic front lines of the recovery and all that your bankers have done to get resources to our small business community. It's greatly appreciated. This morning, we are really fortunate to have with us the Speaker of the Oregon House, and it's especially timely considering that this is Election Day. If you have not voted, please make sure to get your ballots to a drop site. And the Speaker is with us to discuss Oregon's legislative response to the COVID-19 outbreak. And we know that all of you have a lot of questions. So make sure to use the Q&A function. For those of you who are now, I'm sure at this point, becoming routine experts on Zoom. There's a differential between Q&A and the chat function, so make sure to enter your questions into the Q&A section. We really do encourage you to engage with your fellow members and with the panelists through the chat function. So at the end of our remarks with the speaker and some initial questions, we will open it up to those audience questions throughout the presentations. So with that, please join me in welcoming Oregon's Speaker of the House, Tina Kotek, State Representative for District 44, which includes parts of North and Northeast Portland. We are just thrilled to have you here, thrilled that the Speaker of the House is a Portland rep. That's, of course, natural because Portland rocks. So thanks for being here with us and welcome. So let's get straight into our questions. And let's begin really with the straightforward, the thing that everyone has top of mind now, since the governor announced the big news on reopening and the guidelines and some of the counties that have applied and the reopenings that are occurring. So let's start with the reopening. Since the big news on Friday, what is your perspective on how we're approaching the reopening? Just your reflections on the governor's guidance and the flight path that we're taking here in Oregon. Did we get it right as a state?
Thank you, Andrew. And I didn't get to my unmute quick enough, but before we started, I just wanted to say thank you for the opportunity to be here and thank U.S. Bank for these roundtables. I think communication is so important right now in these very challenging times. And I know I'll say this later, but I want to thank PBA and all its members for the support of the local housing measure, which is really important. So just want to say thank you for doing that. On the reopening, I think we got it right. I think Oregon, as people have been reading from national news, is one of the states that has done it better than most states in terms of keeping the infection rate down, flattening the curve. I know even 2 months ago when schools started to close, it seemed so surprising and unnerving that that was happening. Those moves early on have protected our state. And I think there's been a good balance between doing the public health measures, but also allowing a certain level of business activity to continue. If you look at how the governor, our governor, Governor Brown, approached it, how she designated essential workers, but let businesses, if they could manage it, to continue to stay open, I think we did it much better than Washington State did. We were certainly in a different spot in the pandemic when we got started, but I think business activity has been able to continue, but we've been able to have a very strong and effective public health response. So it's that balance of public health and practicality, and I think we've been doing that. I think only time will tell if the course of action has been completely appropriate. It's really up to everyday Oregonians, yourselves, and everybody who's in the state to maintain good practice, staying home as much as possible. I'm particularly interested in making sure there is increased use of face coverings for the purpose of reducing transmission, keeping vulnerable populations healthy, but also allowing businesses to reopen in a safe manner. I think one of the things that I would point out around the reopening is, what is the role in helping businesses get more access to PPE, that type of the masks and the gloves, so they can reopen safely under reopening guidelines. And I'd be curious in the Q&A if anyone here in the association has some ideas about how PBA can play a role in that, what the role of the state should be. But I've been hearing from businesses, particularly on smaller size, who just don't have the capacity to go out and buy that PPE, needing some help to get it done so they can reopen safely. So those are kind of my initial takes on where we are on the reopening.
It's a really great point about the PPE. Early on in the response, we received a call to action from some of our healthcare members, and obviously we're able to respond in a way that I think was really incredible, given the moment that we were so short on supplies at that stage of the shutdown. So hopefully we continue to innovate and be able to create those needed supplies here and develop that economy as we go forward. So let's follow up and let's talk about the greater Portland region. And this is coming on the heels of the three chairs of Multnomah, Clackamas, and Washington being with us on Friday. And they're each at a different stage within their application process for a phase 1 reopening. So what we heard is that Clackamas County is moving ahead with applying for their phase 1 reopening this week. I think they're looking at their application actually today and will likely submit it as of Thursday, was what we heard from a timeline. Washington County sounds like they are a week behind them. And then Multnomah County is on an indefinite timeline because of what we heard from the chair of Multnomah County, that they need additional funding. So what's your perspective on this? Can we quickly reach a funding agreement so that the state's largest county can apply for phase 1 reopening? Give us your sense on the state's response to that need.
Thank you, Andrew. Well, just broadly speaking, it is really opportune that the chairs of the three counties in the metro area are working so closely together, whether it's the housing measure or other things. That kind of collaboration couldn't have come at a better time, as we have to work as a economic region to reopen. I think there's 3 points. First of all, cannot emphasize enough that the reopening of Multnomah County and the two other counties to keep people safe and have a strong public health response is absolutely critical to the economic recovery. We want to reopen thoughtfully, do it right. We want to make sure we don't have a resurgence of infections that are unmanageable in the fall or next year until we have a vaccine. We're in a new normal, but we need to manage the infection rates. And if we don't do that right, we're going to ping pong back into having to shut down again. And we do not want to do that. So first of all, making sure the reopening is done appropriately and strategically is just an economic issue as well as a public health issue. Second of all, it's really important for the counties in the metro area, as well as other counties in the state, like Marion County, to really have a very targeted approach to working with more vulnerable communities, underserved communities, communities of color, particularly the Latinx community, because of the disproportionate impact in those communities. So we have a much more diverse population in the metro area. Each of the counties has to make sure that their contract tracing and their testing is actually reflective of those demographics, and make sure we can get ahead of and try to solve some of those disparate impacts. That's going to be absolutely critical. A lot of folks in these communities are essential workers, so it benefits everyone that we get that right. So that's an important part of the reopening. Third, I will reiterate my hope and expectation that Multnomah County and the city of Portland will figure out how to share the coronavirus relief funds that came from the federal government via the CARES Act. Those were population-based. You can complain all you want about the formula, whatever, the money is here, and the city and the county need to work together, because of the decisions that I'll talk about that we made at the state. They have to collaborate because the disproportionality of the public health dollars, Multnomah County does not have enough dollars to actually do their reopening plan without help from the city of Portland, because we have to reopen safely and quickly, and that's just the reality of it.
That's a really good point. And for folks who are listening in right now, we do know that the chair and her team are presenting to the city council this week. So I think there's that hope for that collaboration, because clearly the health response is in the responsibility of the county. And so having them appropriately resourced to be able to make that response a viable one allows the economy to reopen. But as noted, and as we heard before, that the city was the primary beneficiary of the CARES Act dollars. So it's seeing that intergovernmental relationship work and work effectively is really important for us as a business community. So thank you for that call out. And let's kind of shift into that state and federal government relationship now and talk about the state revenue situation, which, you know, whether or not you're a small business or you're a big government, looking into the crystal ball for revenue is probably an act of futility. However, we do need to make budgets. So let's start with the CARES Act funds. You recently reached a significant agreement with the Senate President and the governor on how you will use CARES Act funds. So why don't you tell us about that agreement, how you came to it, and will there be any additional funds to help the metro area in particular with their reopening plans?
Yep, good question. Well, last week, just to step back even from the CARES Act, Oregon leaders, the governor, myself, Senate President, joined West Coast leaders and Rocky Mountain leaders, legislative leaders, to ask the federal government for $1 trillion in the fourth coronavirus relief package to help state and local government budgets, because the CARES Act money cannot be used to backfill lost revenue because of the downturn in the economy. So we hopefully are going to get some more help from the feds. But in the meantime, we're still trying to make sense of the CARES Act. A lot of money, 46 different funding streams. The Coronavirus Relief Fund is one of those funding streams. It created a minimum payment to all the states and then some population estimates on top of that. So Oregon got about $1.6 billion. About $245 million went to Washington, Multnomah counties, and the city of Portland. So the state has $1.3 billion in coronavirus relief funds. Last week at the Legislative Emergency Board, we approved a high-level framework of how to distribute those dollars. Now, a lot of details still need to get worked out in terms of how all those things will be spent, but we wanted to send a clear message that we had a first plan of how to divvy up those dollars. And what we also agreed to was really $1.3 billion might sound like a lot, but it will go very quickly. And so we want to be really targeted. Our first goal was to make sure that expenses that have been incurred thus far since March up until now, and things we are going to need to spend money on at the state and local level, are covered first. And the priority there is public health. So the state has spent money, local governments have spent money. Let's make sure that we can keep them whole on those regards first. So that's the primary goal. So we took the $1.3 billion with that priority in mind and said, let's say the state expenses have to be taken care of. And we have spent quite a bit of money, either whether it's buying PPE or buying quarantine beds or staffing to do the public health response. And there will be additional costs between now and the end of the year. So we've said about $450 million of the $1.3 billion will go to that. There's another $415 million designated for local government and tribes, and that's actually split into two portions. $215 million for local governments and tribes on a reimbursable basis at the moment. From March 1 until May 15th, local governments and tribes can apply to the state for reimbursement for incurred expenses on the public health side. I'm really interested in seeing what those expenses are. My expectation is that of that $215 million, there will be leftover money that in the second round could be expanded to business assistance. I think that's what we're going to see, but we don't know what the costs have been to local government, so we want to get through the public health reimbursable expenses first. The state has also committed another $200 million through the rest of the calendar year to local government outside of Multnomah, Washington, and the city of Portland to continue to buy PPE, pay for contract tracers, all those kind of public health needs that are absolutely essential for the reopenings that are happening around the state. So that's the local government and tribe pot. And then the last pot is about $525 million in reserves. That seems like a lot of money. I would expect we will be back at the emergency board in a couple weeks with a portion of that money being designated for some emergency investments, housing assistance, potentially utility assistance, additional small business assistance, maybe some broadband infrastructure work, because distance learning and other kind of needs on the internet are going to be really important for all kinds of needs. So we'll be back with a proposal there. Plus, we also want to hold on to some money if there's a surge in the fall. But we do need to spend all of the $1.3 billion before the end of the calendar year. So this will be kind of an evolving process of how to spend that money wisely and strategically. But we are not sending any money back to the Fed, so we will spend it all. We just don't really know at this point exactly how to spend everything, because it's as the pandemic. In COVID time, everything's new every week. So we're doing the best we can. So hopefully that'll help, and look forward to any more questions on that.
It's very detailed and interesting to hear about the transition possible in that round of local government reimbursements to small business assistance. I think the key that most of us are hearing is how critical the cash is now, because even under reopening guidelines, and we were talking about this before the call started, how we as consumers and as customers are not necessarily just running to the doors and going shopping like there's no tomorrow. So how do we slowly, as we relearn how to interact with the business community, make sure that businesses have the resources to phase in appropriately, as you mentioned? I think it'll be interesting to see that, and also what is coming out of local governments. I appreciate that context. And on context, you had mentioned you were one of the representatives that was here in the last recession, the 2008, 9, 10, however you want to put that timeline together. So we all are expecting the state's revenue forecast to come out. And what do you expect? And obviously there's a decline that is about to happen. How big do we expect that to be? And what's the approach? We just heard some of it with the CARES Act resources, but what's the approach to closing any budget deficit?
Yeah, thank you for that. Yeah, there aren't too many of us who were in the midst of the budget discussions back during the Great Recession. I did 4 years at the helm of the Human Services Subcommittee in Ways and Means. So they were very hard years. We did a lot of damage, I think, in terms of the cuts we had to make. We also were able to, I think, crawl out of that recession quicker than other states, because we did pass, for example, a major transportation package. We had stimulus. And so we don't have a lot of institutional memory, and that it'll be interesting to see. I think this will be similarly hard, if not worse. It's a different type of recession. I think the recovery will be consumer driven, different than what it was back in 2009, 2010. But the role of state government and how we manage our budget crisis is an important element of the economic recovery. So at tomorrow's forecast, I'm assuming we'll be $2 to $3 billion down in anticipated revenue across the board: general fund, business taxes, lottery, to pay for the 2-year budget that we're currently in. And we will need to readjust the budget. We cannot wait till next year to do that when we're back in regular session. So I expect we'll have a special session probably before August to do that readjustment. So we are balanced. That's important. For me, it's prioritizing a couple things. One, making sure that essential services from the very basic level and making sure very vulnerable Oregonians are protected is always a priority for me. I also want to make sure we prioritize the types of current investments and programs that will assist with the economic recovery. Getting back on our feet, getting businesses back up to full boom is going to be really important. So that is also an important element for me as we look at budget cuts. We're going to approach it in 3 ways right away. One is let's look at our level of reserves. We're in a different spot than we were in 2009. We have a strong ending balance, over $1 billion in ending fund, available cash right now. Plus we have another $1.5 billion in designated reserve pots that we didn't have back in 2009. So how do we approach this? How much of the reserves do we spend now? What kind of administrative efficiencies can we apply for the rest of the biennium, and some targeted programmatic cuts? So that's the approach we're taking. There will, conversations are starting. There will be Ways and Means budget subcommittees meeting, and that will all kind of turn on tomorrow when we actually see the forecast numbers. I'm really taking it 1 year at a time. I want to get out of this 2-year budget. We will have problems in the next 2-year budget. This is a very difficult recovery to anticipate because of the bizarreness of the pandemic. But if we can get out of this 2-year budget without doing significant damage in the public sector, I think that will be helpful for the economic recovery overall.
That's a great point. And I think all of us are really just trying to, it's interesting to try and budget in a moment when we really don't know the consequences. This is not like an isolated or acute instance where there was a weather event or a seismic event or anything of that nature where the damage is done and then you can begin to diagnose the issue. This is ongoing damage. We don't know the extent of things. So I think your point about this is going to be a learning curve and adjustment as you go is the prime message. But obviously, it's good to know the state's in a vastly better financial state than it used to be able to weather some of these intermediate issues. And I want to transition on to that because you mentioned about shortfalls in budget revenue. And I want to move into the statewide corporate activities tax. So the Portland Business Alliance joined with statewide local business groups from all corners of the state asking for a delay in the implementation of the new corporate activities tax, or affectionately known as the CAT. As you know, we were a key organization in reaching the agreement to avoid a costly ballot fight with this new tax. Our concern is that a gross receipt tax, as you're aware, is a tax that has businesses pay regardless of whether they are making money or not, or profitable for that matter. And we are grateful that the Department of Revenue agreed to waive the late fees and the penalties. But it sounds like this is the only movement that has happened on this. Can you give us a little bit about your perspective about why not the delay of the implementation of this, and just generally your perspective on the statewide CAT?
Yep, glad to answer that, and thank you for the question. First of all, for everyone who has written and talked about the need to delay the payments on the corporate activities tax, I want you to know that I read all those letters, gave it very serious thought. It is a new tax, as everybody knows, and at this point, I think what the Department of Revenue has done with the governor's support in terms of how penalties will be applied, also that additional change in the threshold for businesses not to have to pay till next year, depending on their assumed payment. Raising that threshold, I think, was helped another set of businesses who could wait until next year to pay. I thought that was helpful. I think at this point, that's really where we should leave it until we have further conversation. Here's the challenge that I see. The way the corporate activities tax was set up, we can debate about, and again, thank you to PBA and other business leaders who helped us craft something that, even if we didn't all agree, was the strongest approach we could come to for a dedicated business tax for education. So statutorily, the money that's coming in from the corporate activities tax is directly dedicated to this year's state school fund budget, and going forward, it's statutorily dedicated by percentage to early childhood investments, statewide investments for students, from school meals to equity initiatives, and there's a pot of money that's going directly to schools to have started this coming school year in the student investment account. So any reductions in the CAT, whether that's because of decrease economic activity or delaying payments, either one, would directly impact where those statutory dollars are supposed to go. And so if you can follow my train of thought here, we're going to have a very serious conversation if we make any changes in the CAT, how that will impact the things that it is designated to pay for. And because we assume there will be a reduction in CAT revenues, and we'll see whatever estimates they come with tomorrow in the forecast, that they will be applied to those education buckets right now as they sit. So where the money's going is really important. I understand the challenge of paying it for certain businesses, and I would just ask people to be patient and see how this rolls out and when we see the forecast. But it is very difficult to change course when we have statutorily designated how that revenue is being spent.
Thanks for sharing that perspective. And I think on this sort of train of thought, how are we, and we're going impromptu now, and how to make sure that businesses survive. I think that the thing that we all recognize is that the engine of all of this economy is our business community, and keeping the business community thriving has to be a focus. And you mentioned a really innovative solution, I think I heard earlier, on doing, depending on what's left over from any local government assistance, transitioning that into small business. I think depending on what the outcome is of the need of local jurisdictions, that's a really creative idea. So what else are you hearing, or what are you and your colleagues working on now that might be another sort of innovation within legislation to be able to assist the business community in this upcoming session and to survive this downturn? Be curious to hear what you've heard and what you're excited by.
Yeah, well, good questions. And again, I think my colleagues are most interested in taking targeted approaches, which is difficult when you talk about reducing tax burden across the board. I understand why some people go to that first, but I think what you're going to see is a much more of a preference to go to targeted investments or targeted relief for certain types of businesses because businesses are impacted differently in this downturn, in this recession. It's such a bizarre economic situation. Some businesses are chugging along just fine. Others are never going to get open for another year. So there's a real continuum there. So out of the coronavirus relief fund dollars, we definitely want to look at additional business assistance. We did at the emergency board back in April, designated just some very little pots of general fund money to Business Oregon. That the RFP closed yesterday for the matching portion, where we put some money out through Business Oregon to match with local jurisdictions who had some business assistance programs. That was super popular. Do we put more money there so we can leverage local money? There's also some money going out to supplement through lenders for businesses who couldn't get the payroll protection loan dollars. So I hear there's more money in PPP still, but where are we on that side? Do you put more money there for lending products? Or do you look at certain sectors who have particular challenges that we want to make sure can come return to business after a certain amount of time? Do we go there? So I'm really looking for ideas right now. The other thing I want people to start thinking about, primarily for the 21 session, is bonding. Interest rates are incredibly low. We did not get through the bonding package in the session because it was a failed session. There are some bonding, there is some bonding going out right now in the spring for affordable housing and permanent supportive housing from the state. But what's the best approach to use the general obligation bonding capacity of the state when interest rates are so low? So if people have ideas there, can't wait to hear them. Fortunately, we have a transportation package continuing to chug along as well, even though gas tax revenues are low. So we need ideas. We can't come up with these ideas by ourselves, but it's those kind of techniques that I think are going to be of more interest right now. The one thing I would point out is we have committees starting Friday. I think Business and Labor and Revenue. I think the Revenue Committee will be meeting up next Friday, not this coming, but next Friday, to talk about the unemployment insurance smoothing question, which is also a cash outlay for businesses as well. So those are some of the things we're thinking about right now.
No shortage of that, but I did hear a call out for how do we get creative around things that could be backstopped by bonding on the state level. So obviously shovel-ready concepts, which is something I think we all got used to or acclimated with in terms of the vernacular from the last recession.
We have to keep building more construction. Yep. Mhm.
We agree with that. So now on to, obviously today's a seminal day. This, regardless of COVID or otherwise, this was going to be a major election, especially here in the region. There's any number of ballot initiatives that are out there currently, of course, which are big deals, but also the composition of City Hall, of the Metro Council. There are so many things that are really up in the air and that are transformative for our region here in this primary that make it very consequential. We're very much hoping that Oregon shows out, but especially this metro region shows up big to vote today if you haven't already. But can you give your firm predictions for what will happen come this evening when the polls close and the first ballots are counted?
Oh, I am a little superstitious. I do not do predictions on election day, but I'm particularly watching the housing measure. Unique opportunity for the metro region to continue the momentum on solving issues as related to our unsheltered neighbors. It's really an important measure, so feeling hopeful there. I'm watching a lot of we have a lot of retiring members of the House Democratic Caucus. And so in relatively Democratic heavy districts, we have very competitive primaries, quite a few in the metro area. So I'll be watching those. I did not take any positions in those, so I'll be calling a lot of people, thank them for running, thank them for joining our caucus, because high likelihood is those are my colleagues coming into next year. With the recent passage of Representative Greenlick, the primary for his seat is important because my assumption is that who wins the primary will probably get the appointment to replace him. So those are things that I'm watching. I'll be doing a couple Zoom calls tonight on election night parties. It's nice I don't have to be running around. I usually hit about 10 parties on primary night, so this time I don't have to drive so much.
Yeah, there's some benefit to the stay-home orders, and then at the same time, we can all admit that election night parties are usually some of the best, and the after parties are even more epic. So
yeah, the after parties are more fun. Yeah.
I didn't promote that, by the way. But anyways, so I want to kind of close before we transition into the questions, which we got a really great series of questions here. But how can we help on the Portland Business Alliance side? What do you need from us, and how can we continue to be a good partner for you on the state level?
Mm-hmm. Thanks for the question. Well, again, thank you for the opportunity to be here. Collaboration right now is so incredibly important. Smart ideas. We are all really having to row in the same direction together to figure this out. Having been in elected office during the Great Recession, we do a really good job of explaining the problems, but it takes creativity, collaboration, a lot of hard discussions to get to the really good solutions to move us forward. And Oregon has done well in managing the pandemic this far. We are financially as a state in better shape than a lot of other states. Solid UI trust fund, we have reserves, we have a strong bond rating. I mean, I've seen what's happening in other states, so we could be in a lot worse shape. However, it will be ideas and creativity and collaboration. And I'm really looking forward to working with PBA to, talk about what do your members need? What is the role of the state? Whether it's big or small, my door is always open because we have got to figure this out together because we've gotten this far together. We have to continue to work together to get through this and be on the other side of the pandemic together.
We appreciate that. And I think obviously it's a call out that this is something that none of us have really experienced before. So how do we rebuild is going to be a team effort, and we're all looking forward to working with you and your office and your team and your staff has really been an outstanding partner to the business community. I appreciate that. So just a shout out to your crew. So I want to transition to some of our members and partners who have joined us. And actually, here's a really great question that I'd just like to get off the bat, because you mentioned this before. I think there are portions of the economy which were the first to close down, which are the most dependent on being physically undistanced. And one of those is, and I'm going to just use a broad brushstroke on it, but it's the events business, it's the entertainment, it's our cultural destinations. And I have a question here. I just want to thank Cynthia Furman from Portland Center Stage at the Armory, which is obviously an iconic part of our cultural scene here in Portland. And so into reopenings, we are in the performing arts. This is her question. We are in the performing arts and will be in the category of the last to reopen, which is just, that is common sense, right? The last to reopen. So post-vaccine, or treatment, which we heard from the governor when she announced the reopenings, is when it's possible to start to think about large-scale events. So will there be some mechanisms from the state to offer, and she's putting this out there, bridge funding to our performing arts organizations, or I would say broadly events companies, or anybody who's in the destination experiential business, to ensure that they're still around when reopening can occur for those businesses? It's a pretty meta question and a deep one, and I think something that everybody has thought about. What do we do for events and gathering businesses in the interim?
Yep, it's really important because there is no way for those businesses to reopen in the coming months. It's just not going to be possible. And I think we can all agree that they have economic impact when they're not open, and we want, just from a social and cultural experience, to have those things able to be reopened on the other side of the pandemic. I did actually have a phone call yesterday with the Independent Venue Coalition to talk about this. I think bridge funding is the right way to look at it. Depending whether you're a for-profit or nonprofit venue, you have access to different dollars. The payroll protection program, for example, from the CARES Act, is really a poor mechanism for those types of businesses, probably also other aspects of the hospitality sector, because you're just not going to have that kind of reopening that 8 weeks of payroll was going to help. So I think what you are going to hear from the state is, we want to blend available dollars. So when we did the small business loans, we said for that $5 million that's going to go out, if you got a PPP, you're not eligible. So I think when we look at some of these businesses that have very specific barriers to reopening, what other resources are you able to access? Are we like the last dollar in from the state? Are we helping with very hard ongoing costs like rent? So some of your costs are taken care of. So, all businesses have to make a financial calculus right now if they can stay open and be available for reopening when that time comes. And to the degree that the state can be a partner with those businesses, I am very much open to that. And I could see some of that coming out of the coronavirus relief funds. Now, again, we have to spend it between now and the end of the year, but that's a start. But I think we're gonna have to look at some of these things in 6 months to 1 year increments. A year from now, will we be able to open those venues? That's a question mark. But it is something we are paying attention to, because public policy says you cannot reopen. What is the role of the state to help?
Yeah, that's probably the biggest one here. I think we are completely sympathetic to anyone in the hospitality sector, travel industry. That's one where we will be looking at the impacts of this in a multi-year perspective. So thanks for your insights on that, and our thoughts are with them. On that note, I actually want to really just skip ahead, because you and I were talking about this beforehand about telemedicine, and I see that Dick Clark, who's the CEO of the Portland Clinic, is just asking a really interesting one, because here's an example: Washington taking some action, and can Oregon match it? So I'll read through this, but I think you can all see this here. But independent medical clinics in Oregon represent 60% of the providers in the state. So not the big health and hospital systems that we have, the Kaisers and the Providences and the Legacies. That covers all sorts of areas, and are going through closures, layoffs, because of the huge loss of revenue from not being able to do the elective procedures over the last few months, although those are restarting now. And many people want to keep their appointments via telemedicine, which works pretty well in a lot of cases. Actually, as someone who has a wife in the business, that you can hear and see how that works, and it's great. But telehealth payments go back right now to 55% of what is covered by an in-person visit. So it's a huge disparity between in-person, which we know isn't good right now, versus telemedicine. So can the legislature take action to mandate a parity for telehealth payments, as is done currently in Washington State? Interesting question for a state rep to be grappling with.
Mm-hmm. Yeah, and if it seems a while ago, but we had talked about coming in for a special session, and then that got put off. But you remember we had that joint special coronavirus response committee. And one of the things they did take up was some of those parity issues. We had a telehealth parity bill in the February session that didn't get done. I would like us to have a policy bill in a special session. I would like us to take up those issues in particularly. I think that parity is important. It's been funny. I was telling Andrew to see telehealth is, when it first came up, people were like, oh no, it's going to change medicine. It's like, well, particularly in behavioral health, the numbers of visits and the customer satisfaction and being able to work with providers through telehealth has just blossomed. It's really important. And there should be pay parity. So we definitely have to look at that. And I want to take this opportunity, since the question came from the clinic, to thank the independent clinics, the ambulatory surgery centers, the dental clinics, everybody who stepped up when we said we need PPE. People emptied their cupboards and their closets to get PPE into the hospital systems, in particular into first responders. I just want to say thank you. And I want you to know that I'm going to do whatever I can to help make it easier for you to get PPE back so you can get back to work. Because I've been hearing a few frustrating stories about people said, hey, I donated my stuff and now I can't get any and I can't get back to work. So I'm with you on that. We'll try to fix that.
Well, that's great news for our independent health systems about the parity. And of course, it's a good point about PPA, which many of them did step up to. So thanks for calling that out and double that appreciation. I want to ask a question from Jill Mackey at Vigor. Vigor is just the coolest thing ever. It is a great industrial maker right here in our harbor and all over. And Jill is a board member with the organization. So hi, Jill, I hope you're doing well wherever you are right now. And she's bringing up the point about contact tracing, because now I think it's like, oh, who would have thought that this would just be part of the lexicon, right? I mean, that all of us would be able to just drop contact tracing in casual conversation. But she's really asking the question long-term, what is our dependency on contact tracing and that funding? Because it goes back to the dollars. At the end of the day, if so much is dependent on being able to source out contact tracing, how much is the state focusing on this in terms of its budget? And we had that questions earlier before, but is that a thing? I mean, how much do we need to be resourcing contact tracing to effectively not only reopen, but actually stay open is the key question here. So to Jill's question, contact tracing, where is that in the state budget conversations that you're having?
Right. And thank you, Joe, and Vigor's in my district, and thank you, Vigor, for being a great community partner. That's a great question, because the ability to contain hotspots going forward, so we don't have to have everybody to stay home at the level that they're doing right now, is important. So I agree with you. It's like, we all know what contact tracing and PPE is. Like, we're all experts, right? So on the public health side, it's been interesting to watch what the governor's team has been doing with the reopening plans from the counties. They came with a very hard number saying you must have X number of contact tracers per population to reopen. What they ended up moving to was, can you show when you need to, you have the ability to have that number of tracers available when there's a surge in infections. It's going to be important for everyone to make sure those plans are solid, that counties can ramp up and ramp down those contract tracers. So some of them will be existing employees. You're going to need a solid continuing staff of contract tracers, at least for the next 2 years, who are kind of your core. But to kind of surge up and surge down if there are hotspots will be necessary. I was interested to watch what's happening with the automakers today and how they're dealing with their employees coming in, the assessments they're doing, all the internal work they've done to provide physical distancing within their plants has been incredible. All of that will not, at the end of the day, be completely effective unless when you have a sick worker, you can identify them, find out who they've worked for, who they've come in contact with, tell them to stay home for a couple weeks. One of the things we probably need to provide for businesses, and frankly, more for workers, is some kind of support when I'm an essential worker, I'm just anybody who says, oh, you're infected, you need to stay home for 2 weeks. Who's going to pay for that? How are we going to support that person? We have to come up with that, because if we can get people home and keep them home and away from other folks, then everyone else can go about their business as best as possible. So the contact tracing is absolutely essential. I hope that answered your question, but I be interested to see Multnomah County's proposal, because they are kind of leading the state in their public health approach. So their contact tracing plan, I think, will probably be the model that we'll want to see the other ones actually get to eventually.
That's a great point. And obviously we have some of the depth of health providers here, including OHSU and all of our health system. It's really great that we have these resources, and I think it does set the bar. So I want to move into a good question here from Mary Kay West at PDX Industrial Investments, who is a member, and just thank you for your membership, Mary Kay. And actually this one is really, I've heard this conversation a lot, and it comes from different angles, but this really comes down to the demographic and socioeconomic status, race, underlying medical conditions questions that are related to COVID-19 testing. So, you know, it's a lengthy question, but it is a really potent conversation to be having, because we know about the disproportionate impacts of COVID on people of color. And I just want to ask this to get your sense of things, but would it assist in contact tracing and appropriate dispensing of resources and care, research on systemic inequities, and providing the best possible care of all Oregonians? So why is this info not being sort of consistently gathered, and how can the process be changed so that we have more of this demographic data available to the public for really more policymakers such as yourself? And can we, obviously with respects to HIPAA, but can we also go back to those that have been tested and sort of request that info? So kind of the question about how is COVID impacting different races, different backgrounds, different medical conditions, and is this something we really need to be diving into in a big way to be able to more appropriately respond with the public health response? So that question to you.
Yeah, there's a lot there. Thank you. So the data is really important. Even before the pandemic, my office, I've done a lot of work over the years on equitable access to healthcare. And frankly, even our data that we are required to collect on race and ethnicity for the Oregon Health Plan has been not as good as it could be, because we have a lot of the unknown categories, like people weren't even being asked. So having better data, and it has improved. The Oregon Health Authority has been working on their demographic data to reduce that number of unknown race and ethnicity data points. So that's gotten better. But what we're seeing is now at 30% of the known positive cases are from the Latinx community. That's very high compared to their population. So we need better data collection. One of the things that has been most interesting to me that I'd like to have more info on is, where do these individuals work? We have been tracking whether people worked in congregate care settings like long-term care facilities, which is important, but the pandemic has revealed some very basic things about our economic structure. Communities of color are disproportionately represented in essential low-wage workforce jobs that people have continued to go to work on, whether it's janitorial services or food service or all those types of things. So they are disproportionately in that workforce, and we have said go back to work. We have not done a good job of doing the outreach to those communities. Problem number 2. Problem number 3, the pandemic has really pointed out very clearly the inequities in health status by race and ethnicity. Because of systemic racism, people from communities of color have more chronic conditions. And so when they do get infected because of their job situation, for example, they're more likely to get sick. We can fix those things if we focus on them and have the right data. And what's good in those reopening plans is counties are supposed to have very specific plans on contact tracing and testing for communities of color and underserved communities. So we have to hold them accountable to make sure they are doing those things. And this could be a turning point in providing better access to care for those communities going forward.
Thank you for that. And I think this next question is really interesting. Just the real time, everything is evolving as we go here. But Andrew McGaugh, who is with Work Systems, obviously doing a great job keeping our folks in this region accessing jobs, and asked the questions, the jobs related questions here about the unemployment and insurance reporting, that the wait time for information on the UI line is at 3.5 hours. which is a very long time. So where can the legislature play in that space and making sure that we are fully staffed up, limiting those wait times to get the information? 3.5 hours, seems like a long time. So what's your thoughts on how can the legislator intervene in the unemployment space?
Thank you for the question, Andrew, and all the team at Work Systems. Thank you for the seminars or webinars you've been doing around helping people navigate the unemployment benefits process. I hear that those have been helpful, so thank you. While we as a state have had overall more success in processing our claims in a accountable way compared to other states, it is unacceptable that we have 3.5 hour wait times. It's unacceptable that more than 4,000 people who applied in March still do not have benefits. And what's been happening behind the scenes is legislators have been frankly doing direct constituent work with the department when they get calls from people, trying to figure out everything we can just so they can find out where they are in the process. Having no phone calls back or emails that go off into the oblivion has been incredibly frustrating. I am hoping that the department will take this opportunity to maybe fix their phone program a little bit, have better menus. You should not be getting busy signals when you call the employment department. So we are working behind the scenes. Honestly, they have ramped up a lot of new staff at employment that is helping. But what we will do, legislators are asking every single day, why hasn't this been fixed? What are you doing here? What are you doing there? Because I'm frankly very frustrated. Now, kudos to the federal government that we have some expanded unemployment. I hope we get more expanded unemployment in the next federal package. We also need the Pandemic Unemployment Assistance Program, the PUA program for sole proprietors, independent contractors, gig workers to get really out there. They have started to process those applications. That is important. The federal government's done a lot of good things, but it's been difficult to manage all those new programs in a quick fashion. But nonetheless, we need to actually talk to people and let them know where they are in the system. And that's what we're spending time on right now.
Sometimes just the direct connection to your local legislature is all you need. So good plug for the People's House and the Oregon State House. So I want to hopefully get to 2 more questions. And this one from Catherine Williams over at Northwest Natural, great PBA member, has a board member as well with our organization. So she's asking a really fundamental question. It's one that I am personally interested in, and I just know that this is the interest of a lot of people because it's the underpinnings of the ability to reopen, which is about childcare. So can you talk a bit about what the state is doing to continue to safely prioritize reopening childcare, particularly for healthcare workers, other essential services? How can we get childcare open so it allows people to be able to return to work? And I think those two are obviously and clearly linked for anyone who is a parent and who has been lovingly trapped at home with their children for the last several months.
Oh, good question. Thanks, Catherine. Well, right out of the gate, the state made some changes in the employment-related daycare program, which is the subsidy program for folks who are working, who need help with their childcare. Got rid of the co-pays because those were challenges for folks, and also raised the income level. So essential workers could access childcare. There is about $38 million in additional child care development block grant federal funds through the CARES Act. The state is currently looking at that money twofold. One, to keep providers open. I think we forget that in many cases, these are just small businesses. They are a very critical small business. But we've said, hey, we're going to take your clientele away, but hey, stay open when we need you. So there's some sustainability dollars, I think, being proposed. Also making it clear that we need to put more public money into some of the childcare providers to keep them making it through this kind of rocky business environment for a few more months. I think we will have to take it up again in the 21 session. Oddly enough, when the economy was roaring, we were trying to figure out how to do more in childcare. Now what we have to make sure is we don't lose any providers because we need everyone we have so people can go back to work. So we are spending time on that as well. So thanks for the question.
And now this will be sort of the last one. And for those that I haven't gotten to the questions of, just know that we will make sure that these questions are over into the hands of the speaker and her team to be able to respond if we haven't gotten to your question. Apologies. This one, another really thoughtful question here from a good PBA member, Shannon McCurry at Amy's Community Care. So Shannon is part of a team that operates a social service agency providing in-home support for individuals and those who experience developmental disabilities. So with the recent DHS budget excise ordered by the governor, there were cuts proposed that were alarming to this business for the in-home service sector, which was already underfunded, just like we were talking about with childcare in some senses going into the COVID-19 crisis. Should these proposed cuts occur, it is likely to put agencies such as Amy's potentially out of business and leave individuals without service. So you'd mentioned how do you protect the vulnerable populations as a priority. Will social services, specifically these in-home services, be shielded from cuts?
Thank you for the question. And having watched how we had to really dismantle human service programs back in the Great Recession, I really don't want to repeat that. I am optimistic that the recovery will be shorter than the one we experienced during the Great Recession. It might be deeper, but hopefully it's going to be shorter. And so I think how we handle the first year is going to be incredibly important. The governor's 8.5, which was actually a 17% reduction exercise for state agencies, we're looking at that. We're taking it under advisement. My goal right now is to really get a better sense of how we should spend the reserves. The reserves are there for a reason. Some people will say, well, we should hold on to it till next biennium because we're going to need it there as well. Look, we might need different strategies, but when you contract the public sector and you reduce services, those individuals who have services now are going to go somewhere. In previous recessions, we cut the Oregon Health Plan, and guess who had that spike in need? Mental health services, police services. Folks who don't have their care are going to go somewhere. So sometimes human services don't seem like a business issue. They are a business issue because people in our community are going to go somewhere. They need services. We need to maintain them as much as we can because that is part of keeping the community safe. So we're going to work on it. Look forward to hearing everyone's feedback when we start seeing budget reduction lists.
Great, thank you, Speaker, and that will really conclude this this portion of the event. And just for everyone who we didn't get their questions asked, thanks again for asking them. We will transmit them to the office. And Speaker, to you, thank you so much for joining us today. It was really appreciated. This interactive nature is always the Oregon way to be so available and to speak so candidly. And so we appreciate it. And I think we all can share one single message today, and that is to vote if you have not already voted. So thank you so much, Speaker.
Thanks, Andrew. Thanks, everyone. Bye.
And for the rest of you, please make plans to join us tomorrow, Wednesday, May 20th, for a COVID Recovery Roundtable with Portland Police Chief Jamie Resch. You'll hear what the Portland Police Bureau's response has been to COVID-19 outbreak. Make sure to register at portlandalliance.com, and we will continue to share updates as things evolve. And stay safe, stay healthy, and be well, everyone. Thanks so much.